Lisa here with JustOrthopedic.com, and we are on location at Pine Creek Medical Center, located in Dallas, Texas, just north of UT Southwestern on Harry Hines Boulevard. And I am pleased to be sitting across from Dr. Jesus Rey. He's with Southwest Orthopedic and Sports Medicine. And I know you've been practicing here for a little while. Tell us how long you've been practicing here at Pine Creek.
I joined the hospital about 2 years ago.
Oh, very good. And we know that you do a lot of total knee replacements.
Correct.
And we did have a viewer call, and that viewer called in and mentioned to us that he had spoken to a surgeon previously, and the surgeon was concerned about his weight and asked him to hold off on actually getting a total knee replacement until he had actually lost some weight. Can you tell us why he would have been told that?
Yeah, absolutely. I mean that's a great question, and the reason as to why that is that a lot of the patients that we do see are somewhat overweight, and those would be the patients that obviously would have more pain in their knees. And it's a great, it's a dilemma because in one hand you want to help the patient stop from having pain, obviously, but at the same time you do not want to do something that it would put the patient's health at risk. So, and there are actually some very good studies that actually do show that patients that have increased what we call BMI, or the body mass index, which is a calculation that we do. It's very simple to do that, and as a matter of fact, I will encourage the viewers to actually, they can Google BMI and they will be able to kind of input their info and calculate and see where they are in this in these numbers. But anyhow, if we do know that the increased BMI, it is highly correlated with outcomes in terms of not just pain, but also in the number of complications or percentage of the complications that the patient can have. And so it's almost double than compared to the average population. And the higher the number, obviously, the more complications you have. There was a study done in New York in HSS, and actually did show that there was almost a 20% increased risk in patients that had increased BMI, that is in a patient in BMI greater than 30, in terms of decreased range of motion and continued pain. And there's also an increased risk on the immediate and late complications, meaning infections or the other surgically related problems like clotting and embolisms on the heart and whatnot. So overall, you do want to have a lower BMI before you try to, embark in a total knee replacement.
Certainly for better results.
Absolutely, and it's hard because some patients are struggling to lose that weight in order to get into a more, into a lower number. And there's certain things that I usually recommend to my patients into doing that. One of them being water aerobics. I recommend for them to try to join a gym or a place in which they can get into the water, because the buoyancy of water does help a lot in sharing the load of your weight and allows those patients to do a more aerobic exercise, but at the same time they're burning calories, and it's a good way to just try to stay fit in preparation for the knee replacement.
Very good. Thank you so much.
You're welcome.
This is Dr. Jesus Rey with Southwest Orthopedic and Sports Medicine. I'm Elisa with JustOrthopedic.com, and please follow us on Facebook, LinkedIn, and Twitter.